Hi, my name is Gina Harper, and I'm the clinical coordinator with the Department of Pharmacy at Poudre Valley Hospital in Fort Collins, Colorado. And today I'd like to discuss some key issues regarding antibiotic formulary management for health systems. The first issue I'd like to discuss is why should hospital and managed care decision makers be concerned about evaluating their formularies? There are lots of different reasons to do this. The primary two are clinical and financial. Clinical components include evaluating your antibiogram data. Bacterial resistance is a very dynamic process, and not being aware of your fluctuations in resistance can lead you to poor empiric choices. So monitoring your antibiogram, at least annually, if not monthly, can aid you in altering your initial empiric selections for appropriate choices for infection resolution. So we know that treating patients with certain infections upfront with appropriate empiric antibiotics improves their mortality. Also, staying current on literature is the best way to manage your antibiotic formularies. Financial reasons for reviewing your formulary on a routine basis, including review of generic antibiotics that have entered the market, as well as monitoring for increased cost for certain brand name antibiotics and making adjustments for empiric selections based on that. The second issue I'd like to discuss today is how it's best to evaluate clinical literature regarding antibiotics. Staying current with all of the recent information is your best bet. This is difficult to do given the wealth of information available, but it will help you to stay on top of current practice. An example of this is colistin. If you were to simply use package insert dosing or other drug information reference handbooks, you would provide a significantly different dose than the available literature supports at this moment. Another key component for assessing clinical trial information is whether or not those clinical trials are applicable to your patient population. This is a term called generalizability. If results of a clinical trial seem very alluring, you first need to see whether or not the patient population is considerably different than yours. The study could have been done in a completely different part of the world using a completely different standard of care. Additionally, guidelines can help provide a framework for antibiotic selections for your formulary, and they can cover any range of various infectious diseases-related illnesses. The last topic I'd like to discuss is how best to monitor costs of antibiotics. There are lots of different ways to do this as well, but the most important part of monitoring antibiotic costs is to be consistent. Pick one strategy and stick with that from a month-to-month basis or year to year so that you can track trends and make them more meaningful. And whether that formula that you use is direct drug acquisition costs, daily defined doses, or days of therapy, or some other ingenious method that you have contrived, the important method is being consistent. So identify your top 80% of antibiotic expenditures and then again monitor those for changes. The fluctuation should be put into perspective with any educational efforts you have been providing, any antimicrobial stewardship initiatives, or changes in market costs. Another way of financial monitoring is benchmarking your hospital with other similar sized institutions or your managed care facility. This can provide a nice competitive drive to keep you in check and to reevaluate your formulary constantly.